Advice for the clinicians while handling COVID-19 patients. Healthcare personnel are on the front lines of caring for patients with confirmed or possible infection, hence are at an increased risk of exposure to this virus. CDC has issued 11 recommendations for clinician guidance on COVID-19. Minimize chances of exposure. Ensure facility policies and practices are in place to minimize exposures at all stages, including before patient arrival, upon arrival, throughout the duration of the patient's visit, and until the patient's room is cleaned and disinfected. All persons with symptoms of COVID-19 or other respiratory infection should adhere to respiratory hygiene and cough etiquette, hand hygiene, post visual alerts at the entrance and in strategic places. Provide supplies for respiratory hygiene and cough etiquette at healthcare facility entrances, waiting rooms, and patient check-ins. Install physical barriers at reception areas to limit close contact between triage personnel and potentially infectious patients. Consider establishing triage stations outside the facility to screen patients before they enter. Adhere to standard and transmission-based precautions. HCP who enter the room of a patient with known or suspected COVID-19 should adhere to standard precautions and use a respirator or face mask, gown, gloves, and eye protection. Attention should be paid to training and proper donning, doffing, and disposal of any PPE. Patient placement. For patients with COVID-19 or other respiratory infections, if hospitalization is not medically necessary, home care is preferable if the individual's situation allows. If admitted, place the patient in a single-person room with the door closed and a dedicated bathroom. Limit transport and movement of the patient outside of the room to medically essential purposes. Patients should wear a face mask to contain secretions during transport. Personnel entering the room should use PPE. Whenever possible, perform procedures, tests in the patient's room. Once the patient has been discharged or transferred, the room should undergo appropriate cleaning and surface disinfection before it is returned to routine use. Take precautions when performing aerosol-generating procedures. Some procedures performed on patient with known or suspected COVID-19 could generate infectious aerosols. These procedures should be performed cautiously, wearing PPE, and avoided if possible. Collection of diagnostic respiratory specimens. When collecting diagnostic respiratory specimens, the HCP should wear an N95 or high-level respirator, eye protection, gloves, and a gown. Clean and disinfect procedure room surfaces promptly. Manage visitor access and movement within the facility. Limit visitors to patients with known or suspected COVID-19. Encourage use of alternative mechanisms for patient and visitor interactions such as video call applications on cell phones or tablets. All visitors should perform frequent hand hygiene and follow respiratory hygiene and cough etiquette precautions while in the facility. Implement engineering controls. Design and install engineering controls to reduce or eliminate exposures by shielding HCP and other patients from infected individuals. Examples of engineering controls include physical barriers or partitions to guide patients through triage areas, curtains between patients in shared areas, and air handling systems. Monitor and manage ill and exposed healthcare personnel. Facilities and organizations providing healthcare should implement sick leave policies for HCP that are non-punitive, flexible, and consistent with public health guidance. Train and educate healthcare personnel. Provide HCP with job or task-specific education and training on preventing transmission of infectious agents. Ensure that HCP are educated, trained, and have practiced the appropriate use of PPE prior to caring for a patient. Implement environmental infection control. Dedicated medical equipment should be used when caring for patients with known or suspected COVID-19. Ensure that environmental cleaning and disinfection procedures are followed consistently and correctly. Management of laundry, food service utensils, and medical waste should also be performed in accordance with routine procedures. Establish reporting within and between healthcare facilities and to public health authorities. Implement mechanisms and policies that promote situational awareness for facility staff. Communicate and collaborate with public health authorities.